Hello and welcome. This webinar on consumer engagement is presented by Florida Health Information Management Association Consumer Engagement Committee. This presentation objectives are: define what is consumer engagement, state FHIMA's and FHIMA's objectives on consumer engagement, review current consumer engagement topics and trends, define the HIM professional's role as an engagement advocate, best practices overcoming challenges to consumer engagement, and providing available and reliable resources. What is consumer engagement? It is a diverse set of activities connecting consumers with their health information and includes face-to-face, mHealth, or telehealth. It encourages consumers to have health information accessibility, to maintain a personal health record, and to take an active role in making decisions in regard to their personal health care. FHIMA's strategic objectives on consumer engagement are: connect consumers to their health information, partner with others to directly reach consumers, educate consumers to ensure they understand their rights relative to accessing their health information, and of course, to be the trusted voice across the health information environment. FHIMA's consumer engagement model: inform consumers of current topics and resources to support FHIMA's strategic effort to connect consumers to their health information, regional updates, meetings, conferences, and webinars, FHIMA and FHIMA's alerts, engage, directly interact with consumers and their families and caregivers, and partner, collaborate with healthcare facilities and healthcare providers to educate, empower, and engage patients and their families and caregivers. For this presentation, we will take a look at some common consumer engagement topics, which will include personal health records, patient portals, patient rights, accessing and amending medical records, mHealth applications, privacy and security concerns, patient-generated health data, current challenges, and the HIM professional's role. What is a personal health record? It is a collection of information about your health. It can be in paper format or electronic format. It is not the same as electronic health records or electronic medical records. It is an organized way to track, access, and manage health information. What information goes into a PHR? Your primary care doctor's name and phone number, allergies including drug allergies, your medications including dosages, chronic health problems such as high blood pressure, major surgeries with dates, living will or advance directives, results of screening tests, cholesterol level and blood pressure, exercise and dietary habits, health goals such as stop smoking or losing weight, family history, and immunization history. What is a patient portal? It is a secure online tool to personal health information, such as websites or through a mobile application. It gives you 24/7 access anywhere an internet connection is available, and can include doctor's visits, medications, immunizations, allergies, and lab results. It is not the entire medical record. For example, psychotherapy notes will not be included on the patient portal, and it can incorporate secure communications between the patient and the providers. Patient portal benefits. Some of the benefits of the patient portals are to improve patient-provider relationships with stronger communications, empowering patients access to healthcare data and information, supports care between office visits, promotes improved patient engagement for successful outcomes, and ease of sharing information with family and caregivers. Patient portal trends. Communications with providers and access to health information can be made through personal computers, personalized digital devices, mobile device information sharing, and wearable technology devices. Patient portal implementation considerations should include: is the portal on a secure network? How are invitations to join a portal sent in person versus email? Is it password protected? Are proxies permitted? And how are passwords reset? Who owns the patient portal? The healthcare facility typically is the owner of the health record. The patient owns their information in their health record, but not the portal itself. So the provider is responsible for the portal and all information uploaded. A FHIMA Consumer Engagement Bill of Rights states that the consumer has the right to look at their health information and/or get a paper or electronic copy of it, have accurate and complete health information, ask for changes to their health information, know how their health information is used or shared and who has received it, ask for limitations on the use and release of their health information, expect their health information to be private and secure, to be informed about privacy and security breaches of their health information, and to file a complaint or report a violation regarding their health information. Accessing and amended medical records. The 21st Century Cures Act on October 6, 2022 made it mandatory for patients to have access to their protected health information maintained by a covered entity or its business associates. HITECH also provides the right for patients to receive their information. Access must be granted within 30 days of a request, and the provider is allowed an additional 30 days extension. Providers may deny patient access to medical records in certain circumstances, as with psychotherapy notes. Patients can request a change or amendment to their health record. Provider's responsibility. The healthcare provider must respond to the patient's request for their medical records no later than 60 days after the request is received. If the healthcare provider created the information, he or she must amend inaccurate or incomplete information. If the provider does not agree to the request, the patient has the right to submit a statement of disagreement, and the provider must add the statement to their medical record. What is a mobile health application? Known as a mobile health or mHealth? Well, it's the use of devices in the practice of medicine. The downloading of health-related applications or apps. It helps with the flow of information over a mobile network and can improve communication between patients and providers. When considering a mobile application, think APP. A. Advice. What you should consider before downloading a mobile health app. P. Privacy. What you should know about the privacy and security of a mobile health app. P. Personal. What you should think about in terms of your personal health information when using a mobile health app. Advice. When looking for a mobile application, questions to consider are: why are you considering this app? Did your doctor recommend this app? Will the app help you reach your health goal? Is the app helping you learn more about your personal health? Have you checked user reviews before downloading? Is the app easy to use? Are there any user concerns or problems with this app? Privacy when looking for a mobile application should ensure the privacy of personal health information. It's important to review privacy policies and settings of both the application and the mobile device, and to look for signs of certification of privacy, such as the trustee seal, which certifies privacy. Personal. When looking for a mobile application, it should secure your privacy. Things you can do are utilize password protection and encryption where provided, record your phone's identifier somewhere safe, use a locator service such as the GPS capability on your smartphone, use a remote wipe which lets you erase your handheld's data in case it is lost or stolen. And don't share confidential and personal health information. Patient-generated health data resources includes health questionnaires, data points such as blood pressure or glucose levels, self-management diaries, patient or family health histories, and healthcare directives. Areas likely to play a significant role in patient-generated health data resources are mental health disclosure protection, role of health plans as significant stakeholders in the engagement process, role of employers as drivers of creating a culture of health, emergence of new technologies that will facilitate patient, family, and provider interactions, health education, treatments, and overall engagement. Role of social media as a means to enhance communication and networking with individuals and communities. FHIMA's recommendations for management of patient-generated health data by mobile health technology includes creation of strategic information governance framework, includes patient-generated health data as part of an overall organizational information governance initiative, develop policy and procedures, identify and define the intended use and reliability of the technology that is used to collect patient-generated health data, and incorporating it into the existing electronic health record system. Work with information technology leadership and electronic health record vendors, and identify and evaluate technology solutions. Other recommendations include establishing an inventory of the various types of the most frequently used mobile health devices, defining policies for clinical documentation requirements, updating legal health record definition to include patient-generated health data that is used for decision making, establishing workflows to ensure review and validation for the use of patient-generated health data by clinicians, and review and update existing coding workflows. FHIMA's recommendations for management of patient-generated health data requires HIM involvement in reviewing capabilities with EHR vendors, determining the need for data tags or notations within the HR, working closely with compliance and risk management, the development of regulations and standards, and completing a gap analysis for privacy and security for patient-generated health data integrated with the electronic health record. Current consumer engagement challenges includes lack of involvement, maybe due to limited skills or time, cost considerations, privacy and security concerns, health information exchanges and interoperabilities, emerging technology and technological advances, and ease of access to unreliable resources for information. Former FHIMA CEO Lynn Thomas Gordon defined the HIM professional's role in consumer engagement, and I quote, "Traditionally, the clinical care team played the major role in the patient experience, but the change in the way patients consume their health information means today's HIM professional plays an important role in giving healthcare consumers the tools needed to make all interactions and communications with their providers meaningful and efficient." End quote. So it's roll call time for HIM professionals in consumer engagement. Things we can do: provide resources and information to consumers, communicate with patients, for example, explain how their information is exchanged and identified, assist patients, for example, show them how they can contribute data to their health record, and explain how the electronic health record or personal health record benefits patient care and continuation of care, for example, with COVID patient treatment and medical emergencies. Using the acronym HIM when it comes to consumer engagement, this means helping individuals manage their health information. H, helping, I, individuals, M, managing. Helping individuals manage their health information in a private and secure environment. HIM professionals in consumer engagement can also study the HIPAA standards, identify and establish policies, procedures, and processes, become knowledgeable about other applicable federal laws and regulations, have links to state laws and regulations websites, utilize other resources worth consulting, such as component state health information management associations, confidentiality, or release of information manuals. In addition, ask legal counsel to ensure that new and revised policies and procedures comply with all federal and state laws and regulations. Train members of the workforce on policies and procedures with respect to protected health information, maintain appropriate documentation, review contracts with any business associates, and monitor compliance and implement corrective action where indicated. HIM professionals should also ensure that consumers are informed about the organization's information practices, provided access to their own health information, provided a mechanism to make amendments, asked for authorization for disclosure not otherwise allowed by law, and allowed access to and copies of disclosure logs. Encourage non-covered entities that maintain individually identifiable health information to construct policies and procedures that are in keeping with federal, state, and local government laws, as well as the facility's own policies and procedures. In addition, information obtained or disclosed should be the minimum necessary for effective results, and the workforce should be trained about the importance of privacy and confidentiality on an ongoing basis. How can HIM professionals continue the trend of increased confidence among patients? Well, they could stay abreast of current patient perspective, seeing things from the patient's point of view, know patients' rights and how they use their health information, facilitate ongoing training on privacy, security, and confidentiality within the workforce, and of course, utilizing various toolkits and resources on privacy and security provided by FHIMA. Thank you for your time in listening to this presentation on consumer engagement. In conclusion and to summarize, I encourage you to definitely become the consumer's trusted voice when it comes to engagement in accessing and understanding the benefits their health information provides. Consumers have different needs and fears, and the key is to make it easy for them to move along in the process of engagement. Please take time to familiarize yourself with the following resources: FHIMA toolkits, body of knowledge, conferences, webinars, videos, and library. FHIMA's Consumer Engagement Committee brochures and handouts, conferences, and webinars. FHIMA's Patient Bill of Rights, Patient Portal Frequently Asked Questions and videos, web links, and our email address, consumerengagement@fhima.org, is always available for any questions or concerns. Thank you.